versus Wolfe.
Good morning. Doug Wolfe with Koenig, the general manager of WAND TV. Your editorial this week, really important, deals with healthcare here in Central Illinois.
Yeah, well, we're finding out that, we have some hospitals that are closing down facilities. We've got some hospitals that are trying to expand to try and keep up with things. I mean, Memorial is really in a no-win situation here. They lost 500 to 650 jobs over the last couple of weeks, trying to scrunch down about 5% of their payroll. But, the patients are suffering because over 70% of the patients here are on government-rated bill payers, so Medicare and Medicaid. And these services are not covering the cost of care. So there's no way a hospital is going to make money. You're going to start seeing closures all over the place unless the government gets in gear and does the right thing.
We've seen several hundred, as you mentioned, in Decatur and Springfield. Here in Decatur, HSHS earlier this year cut inpatient rehabilitation. Their obstetrics and newborn nursery are not delivering babies anymore. Pediatrics was cut, and also inpatient behavioral health services. Also, Decatur ambulance service, St. Mary's cut that. These medical facilities, not just here, but across the entire state, are in big trouble.
You have between 11,000 and 13,000 people turning 65 years old every single day. All these different places that provide care, they're going to have to expand. There's no way to expand if there's no margin because the government isn't giving their fair share to cover the costs.
I was telling you before this show started, I interviewed Dick Durbin, the state U.S. Senator, not state senator, U.S. Senator Dick Durbin. I interviewed him a couple weeks ago. He was telling me there's one small hospital. They had 4 nurses in a particular unit, 4. 2 of them quit and became traveling nurses and basically offered their services back to the hospital, but at a much higher rate.
Sure.
And the hospitals don't have that money.
Right.
It's going to create a significant impact on that hospital's bottom line. So now you've got these hospitals going back to the government going, hey, you got to help us. And the government don't always have the money to help them.
Right. Yeah, I mean, and this is going to continue to happen across the United States because there's no profit margin anymore. Hospitals used to make money. I mean, you see on their bill, you get Tylenol, $8.50. They have to charge numbers like that just to cover the cost of what Medicare and Medicaid are not paying.
Right. And then the other problem is finding people who are qualified to work in these positions. And it's like every other position, McDonald's or anywhere, they cannot get people.
COVID has sped up everything. Last week we talked about television viewing habits. This week we're talking about how COVID has sped up, for all this palliative care and everything changing, hospitals shutting down these wards. I mean, that Memorial had to make a huge investment just to cover obstetrics in this town because now they're responsible for all the babies being born here in town.
Exactly. All right, we're going to take a quick break and we'll be right back.
We're back. You're watching Koenig versus Wolfe. Doug.
Got a great question for you.
Yeah.
You've got Decatur, 2 hospitals. You got Springfield with 2 or 3 hospitals, maybe more. I haven't counted them all. Can Central Illinois, can Decatur, Springfield, for example, or even Champaign with the multiple hospitals, can these cities survive anymore with that many hospitals? In other words, should we be down to 1 hospital? Do we really need 2?
Well, let me answer your question with the question. Last year, 350,000 people left Illinois. What do you think is going to happen?
Where'd they leave?
They left to other states.
No. Did they leave Central Illinois or did they leave Chicago? Where'd they leave?
They left Illinois. I'm saying 350,000 people statewide left the state. So this state's going to continue to contract. And a lot of it, of course, is because of Chicago. If Chicago was sawed off, and I'm from Chicago. Look, I can see,
That's a whole different other
issue. It really is.
We
would be
getting rid of Chicago.
In the green for sure, or in the black.
I don't think, I've got family at both hospitals. I got to be careful here. But
sure.
Honestly, I don't think this city, Decatur, I don't think Champaign and Springfield can continue along this path of this many hospitals.
Well, just look at the population. I mean, I've been here, it's been close now to almost 15 years. I heard when I got into town it was like 107,000 in the population. Now we're in the 60,000 range. I mean, it's just these towns are going to continue, contract, and this is what's going to happen. I think, COVID, we talk about sicknesses, is it giving people other sicknesses? What we haven't seen is the socioeconomic status because of COVID. And for the next 10 to 15 years, we are going to see different shoes falling all the time, dropping to the tune of it's not where it's going to be near what it used to be. You know, those days are over with. Same days with television, the happy days of TV.
Even the ambulance services, I mean, we obviously had Decatur Ambulance. They're gone. It was filled in by Arrow, I think is the name of the new company. But I know they were having trouble hiring people to work for them. Forsyth just started their own ambulance because they needed that service. So the Forsyth Fire Department, I think, is running their ambulance service now. And these smaller towns, you know, you've got Shelbyville has its own hospital. Does a small town like Shelbyville need a hospital? Yes, because they're out in the middle of nowhere. It's a long ride up to Decatur if you have an emergency, right? But can they afford to continue to run a hospital down there?
The level 1 care, that is Springfield, correct? So if somebody is in an emergency situation, they're life flighted over to Springfield, correct?
In some cases, yeah. Okay. I mean, DMH can handle quite a bit of that, or no longer Memorial in Decatur can handle that. I know St. Mary's flies a lot of people over to Springfield.
And it's hard to believe, but it's almost 4 years for that transition from DMH being purchased from Memorial, I believe.
Could be.
So I mean, it's going by fast. It's going by fast.
Yeah, I know. And I'm a person getting older. I need more medical care, just being an older person.
How does it affect you when you see these things going on? I mean, we talked about people turning 65. You're thereabouts.
Yeah, my generation.
So, I mean, what do you think about seeing stuff like this happen?
Well, I have friends dying. You know, you get to that age where, you know, it's not a lot now at 65, 66, 67, but as we get into our 70s, 80s, people are passing away, or people are living a lot longer because the medicine's so good. We've made it so people are living into their 80s and 90s quite often.
Sure.
And they need more and more medical care to keep going.
All right, so if you were the CEO of Memorial.
Man. We'd be closed.
Well, I mean, you've just cut 5% of your workforce. Thank goodness that they really didn't touch clinical. You know, they're taking leadership positions, upper management positions. They're doing the right thing. Yeah. I mean, let's be serious.
They got rid of the valet service out front.
Right. You know, I mean, or people registration. I mean, I understand, but they didn't, you know, they hardly touched that clinical care, and that's what we need here.
Yeah.
For sure.
And some other services, like is Vita, is that what it's called up on Pershing Road? That's for women, and I believe that's getting cut as well. So, I mean, it's just not the hospitals, it's all these ancillary services.
Yeah.
Ancillary is the word I think I'm looking for. All these ancillary services in the healthcare field, they can't survive either.
Now, look, Memorial's not going to turn you away or anything like that.
If you need, and neither is St. Mary's.
Yeah, I mean, these hospitals, they're doing the right thing. It's just a shame that they're going through that situation because you're going to see a lot of businesses changing the models, you know, with what's coming.
Well, when you're locating a business somewhere, let's say I want to bring my business to Decatur, one of the things I'm going to be looking at is healthcare and whether the hospitals are available, doctors are available. I'm not bringing a big company here and not have any kind of healthcare.
Yeah, and how are these hospitals bringing these physicians in? Especially from out of state. I mean, they must be offering something up, you know, to get these doctors to move here,
I would hope
right?
it's money, I would think, right?
Right,
That's probably the answer. How much are you paying?
So the payroll continues to grow, expenses continue to grow. I mean, it's everyone's business model at this time.
Sure. It's like any other business, you know, if you're not paying your people, they're going to go look for something that's a little bit better maybe.
Well, I think, you know, in closing, I'm proud of how Memorial has taken care of the situation, especially with the other hospital in town, you know, starting to act some of the
services.
Services and entities that they have. I think, you know, Memorial's got a lot to bite off that they can chew right now because it looks like they're going to be one of the sole providers here in Central Illinois as far as Decatur, you know, for ambulatory care and surgery services. But, you know, it's going to be interesting on what's going to be happening here in the future. I love that we're talking about stuff like this, Doug, because I think it's going to give, you know, the viewer a chance to understand where we're coming from, what our views are, what our opinions are. And, you know, it's topics like this that are important to cover.
And DMH, you calling them DMH, Memorial, like, it's old habits. Memorial, they didn't just axe people for the heck of getting rid of people.
No.
They had no choice.
It's a business model. You know, they're treading water at this point.
Absolutely.
All
right.
Thank you, Doug.
Thanks for doing the editorial, and we'll be back next week with another Koenig and Wolfe, Koenig versus Wolfe.
Love it.